Hello, welcome to the Coach's Corner Show, brought to you by Beggar's Pizza. I'm your host, Pat Disabato from the Southtown Star newspaper, and Happy New Year to everybody. Hope all you people had a great holiday season. I know I did, and we're starting the new year out with a bang, folks. We are at Athletex Sports and Orthopedic Physical Therapy in Orland Park. Our guest is the guru, Tom Mulvey, owner and physical therapist, among other things here. Again, we're at the Orland Park location, 11140 West 179th Street, all right? And there's a second location in Hometown, and that is at 4114 Southwest Highway. And the key about that location is right down the street you have Billy's Diner, greatest breakfast joint. Forget the south suburbs, all the Chicagoland area. One of my all-time favorites, Billy's. I'm sure Tom's been there. We'll pick his brain a little bit on that. All right, folks, we are going to have a bunch of great information with Tom, from running, what happens when you run, common pain in athletes, a parental approach, what you need to look for, and we're also going to do some things about lower back pain in athletes. So Tom is going to hit us with all this stuff, very knowledgeable. You guys will know what's going on here. So sit back, enjoy the show. 3 segments with Tom, and at the very end we'll have Players of the Week and Coach of the Week, and High and Tight. All right, we're going to a Beggar's Pizza timeout, folks. We return. Tom Mulvey from Athletex. Stay tuned.
Having surgery or dealing with some type of nagging pain that limits your function? Then get to Athletex. We offer treatment for all types of orthopedic injuries, work-related injuries, and sports injuries. Therapists with over 20 years of experience provide treatment that is efficient and effective. Our 2,000 square foot clinics offer state-of-the-art equipment from HydroTrack, Blankenship, and Biodex. If your doctor suggests physical therapy, then you suggest Athletex, where every patient is treated like a champion.
Well, welcome back to the Coach's Corner Show, brought to you by Beggar's Pizza. All right, folks, rehabilitation, preventative training, our guy Tom Mulvey from Athletic Sports and Orthopedic Physical Therapy. 22nd year is our guest this week. Tom, thanks again for coming on board.
Great to be here.
A staple every year. And we're going to talk about running. People just lace up the old sneakers and take off, but let's talk about some things and the importance of running for different sports.
Running, most people think about it, being utilized for your runners, your marathon runners, your race runners, but every sport you run.
Yep.
And, from a young age to as we get older, techniques continue to evolve in that person. So it's important to just look at running and really pay attention to see, does it look appropriate or does something look wrong?
Yep.
And from a young age, we want to start doing that. So we're going to talk a little bit about some of the phases of running and what happens.
So during running, what happens, right?
Right. So we have an ankle here, and as you run, you go through a series of 4 different phases. One is heel strike. So you come and you strike with the heel, and with that strike, your foot is actually turned a little bit out. And as you come from heel strike, you come into what's called a foot flat position.
Okay.
And in that position, the foot is starting to turn in a little bit. And as you go through foot flat, you go to a push-off or a toe-off position, and the foot, again, rotates to give you power there. Then you quickly lift that foot up and come through in a swing through to return back to heel strike.
Okay. So what structures function during these phases?
You have, as you come into heel strike, you have a muscle that's called the anterior tibialis, and that's a very important muscle because people develop what's called shin splints.
Yep.
So it's important.
I've had those before.
It's important to see that movement is somewhat normal. As you go from heel strike, you approach more into a kind of you go towards your foot flat position. You have a posterior tibialis, and you also have your calf getting ready to start to help you into the push-off position. From foot flat into push-off, you got your calf, you got that posterior tibialis pushing off. Then very quickly you cycle through with the anterior tibialis, bringing you back to load at heel strike.
Okay. So in knowing the movements and the structures, Tom, that you talked about, can you determine what causes the pain?
It's very important. As you analyze that movement, you're able to see what that particular athlete might lack. If they don't come into heel strike appropriately, that anterior tibialis muscle is going to be working more. Maybe that calf is tight. So by looking and assessing that movement and the series of those 4 phases in the movement, it really helps us to determine where, if they don't have pain, where they potentially can have pain.
Okay, and this diagnosis, plantar fasciitis, I mean, you hear it, it's becoming more and more common. I think Joakim Noah of the Bulls
Yes.
had a problem with this. So what
Absolutely.
is
So you have the arch of your foot here. Underneath the arch, you have a structure that's called the plantar fascia. The plantar fascia's main role is to really support this, what we call the medial longitudinal arch.
Okay.
And if that plantar fascia is, on some people, let's say for all intents and purposes, stretched out or a little bit weaker,
Okay.
they'll have more of a flattened foot. Some people will, again, a lot of it is genetic, will have a really strong arch there, and that's a very tight plantar fascia. The thing is that you can't look at that structure just by somebody sitting and showing you their foot. It's
Okay.
really as they bear weight is what is most important. And someone that then has plantar fasciitis has an inflammation of this tissue. And when you look, you brought up Noah in regards to his problems with plantar fasciitis. You know, it's a weight-bearing structure that allows shock absorption for the foot through every athletic weight-bearing movement.
Okay.
And so if that is inflamed, it's a very, very difficult thing to get under control. Once the pain is gone, you have to wean that person back into activity, knowing that you can provoke it again.
And he has provoked it countless times. So what is the iliotibial band?
On the hip, on the outside of the hip, you have a structure that's called the ITB band, the iliotibial band. And it's a structure that runners experience pain with quite often because not only is it tight, but it allows for the lateral transition of force as you run. So it's a very tendinous structure. Not a lot of muscle as much as tendon, decreased blood flow in those tendons so it doesn't heal very quickly. But the key is that around the hip there's not a lot of tissue, there can be friction there. So it's something that we really have to look at as somebody runs to make sure that, that there's proper elongation of that tissue and that it doesn't really stay tender. If there's pain there, they'll change their running style and that provokes other problems.
Okay. As we talked about earlier, sports, you have to run.
Sure.
Everybody runs in sports,
Right.
but why are there different running techniques among the athletes?
Well, think about, I followed, we were at a soccer game, a walkout. I find myself at activities looking at how young kids walk or how they run.
Yeah.
Watch a young lady walking out after the game and she's walking predominantly on her toes. You have to look at the different sports that they play. Baseball, they're on their toes a lot. You know that those kids are going to predominantly be on their toes. Somebody that's in basketball, not so much, but they jump, but they also, a lot of them will run with lazy, flat feet that'll slap.
Yep.
You have to look at the different activities that they have and try to incorporate normal running technique.
Okay. And good running shoes, what do people need to look for in that?
Three things. They need to have a
Other
good...
than $200, $300.
Right, don't have to be. Good heel counter in the back. They need to have a good cushion in their heel. And they also need to have the ability to put in an appropriate arch support so that we can support that medial arch that we talked about. Even people that have an arch, preventatively, they need some structure there to help the cushioning as they go through the running movement.
Okay. All right, folks, we're finished with one segment. We've got plenty more with Tom. We're going to hit on this next segment, common pain in athletes. Now, your son or your daughter comes home, they're aching here, aching there. Are they being a wimp? Are they soft? Or is something seriously wrong? Well, Tom's going to let parents know what to look for in some of those instances. Hello, welcome back to the Coach's Corner Show, brought to you by Beggar's Pizza. If you are just joining us, we are at Athletex, Sports and Orthopedic Physical Therapy in Orland Park. Our guest, Tom Mulvey, owner and physical therapist. And before we get jumping in, Tom, both locations, state-of-the-art equipment, and I've been telling people this for years, that you are the best. You do this from your heart, and your reputation means everything to you. So when people come to Athletex, either location, what kind of services do you offer?
Pat, we, almost 22 years, we've, done everything that we can to make sure that we get people either back to work, or we get them back to their activities, get kids back to sports. We've seen a lot, and
Yep.
so our experience really allows us to expedite the process. It allows us to look at, what that individual is going through and what ways that we can get them back as quickly and as efficiently as we can.
Yep.
Orthopedics, work comp injuries, we've been around for a long time and we really enjoy what we do.
Yep. Well, you know, in this, obviously, we have a lot of athletes that watch this show, and their parents watch this show. So, and a lot of parents see their kids come home, and they have some sort of pain. So, what is it about the parents', you know, approach to certain, you know, injuries? How should they go about this?
More and more insurances are changing. There are a limited number of visits these kids are being able to get for therapy. Parents have to be more involved in everything. So, when they are coming home with injuries, or they're coming home with aches and pains, there's a few things that these parents need to think about. And you know, what is the area of the pain? If the area is a very broad area and you know, encompassing, you know, over a couple of joints, whatnot, and that person really hasn't had any trauma that you can think of, or it's something that's relatively new, you can kind of keep an eye on it for the next 24, 48 hours and see what happens. You can have them do very simple things, maybe soak in the tub, see if the pain starts to feel better. Watch their behavior. Yep. That's the biggest indication. If they feel like, if it appears like they're starting to move better, then you worry less. As a rule of thumb, if within 24 hours they still don't want to bear weight, it's really a good idea to have that checked.
Yep. And now, what about overuse injuries?
You know what? It's happening more and more. You have athletes that are training. You have athletes year-round. You have athletes that are going to, you know, extra conditioning. You have athletes that are going to classes to work on technique. I mean, they're really doing more and more now. So a lot of the injuries that they're experiencing, they do kind of progress back to the time when we had the factory workers that were doing repetitive activities and coming up with specific areas and types of pain.
Yep. You know, I hear this growth plate a lot, and I've had a buddy whose kid, it prevented him from participating in sports for almost a year. How's this affect athletes?
You have a bone, and we're going to take the femur here as an example. You have a bone here that has what's called an epiphysis, and it has here what's called a metaphysis.
Okay.
And in the middle between those two is an area of cartilage in which growth occurs. Sometimes when you have an injury to the joint, there's a fracture that may occur near that area. And when that happens, it's very, very important that you know, that somehow that we keep an eye on it to make sure, because it can have an impact on how that growth plate, how it actually, the growth occurs or the growth stops. Okay. So it's very important that that is monitored, and if the fracture avoids that growth plate, it makes things a little bit easier. We don't have to be so careful. But when it's in that area, especially in you know, an adolescent or a young athlete that's growing, it's extremely important to make sure that that heals properly.
Because you know, you hear Osgood-Schlatter disease. There are a number of different things that develop.
Now you have something that's called the apophysis, and you have certain points, like here in the tibia, you have certain points in which a tendon actually inserts into the bone, and it's a bony cartilaginous type area, and where that tendon attaches there, a lot of force is placed on that area of bone. Now the thing is, these things that we'll talk about, these apophyseal problems, are because growth occurs faster in the bone than that tendon is able to keep up with it. So let's say Osgood-Schlatter. The long bones here of the femur and tibia grow so fast that there's excessive force placed on here, and you'll see a very, very prominent bony growth occur there.
Okay.
And it's very, very common, and usually those people can still compete. They're given anti-steroidals by the doctors, and you have to change their training program so that they reduce and participate as is tolerated by pain. Seaver's disease is a very similar thing that occurs in the heel at the calcaneus. Same thing, that you have the Achilles tendon inserting here, and that pull occurs, the maturation here, they're growing very fast, and there's excessive pull here, and they get a very tender, irritable heel. In the hip flexor region, very, very common. Here, and right off of the area of the pelvis, you have a hip flexor, the same thing. That bone, that tendon can pull as the growth of the femur occurs so fast that it pulls away at that area of the pelvis and can, you know, create excessive pain. And again, even you have to watch the growth plate of the pelvis. Finally, even at the medial epicondyle of your elbow, where the ulnar collateral ligament attaches, that also is a very tender spot.
I know it?
That's why your throwers that start to change their technique at a very, very young age, when they're not skeletally mature, can have a lot of problems there.
Okay. All right, folks, we are going to go, coincidentally, to an athletics timeout right now, okay? And we come back, we're going to pick up where we left off on this frontal approach, and more great stuff with Tom Mulvey from Athletics. Stay tuned.
Having surgery or dealing with some type of nagging pain that limits your function? Then get to Athletex. We offer treatment for all types of orthopedic injuries, work-related injuries, and sports injuries. Therapists with over 20 years of experience provide treatment that is efficient and effective. Our 2,000 square foot clinics offer state-of-the-art equipment from HydroTrack, Blankenship, and Biodex. If your doctor suggests physical therapy, then you suggest Athletex, where every patient is treated like a champion.
All right, welcome back to the Coach's Corner Show, brought to you by Beggar's Pizza. All right, we're with our guest, Tom Mulvey from Athletic Sports and Orthopedic Physical Therapy. All right, Tom, we left off with common pain in athletes. What other areas are common for pain in athletes?
Very common, Pat, patellofemoral pain, and usually it refers to pain that occurs around the kneecap, and it can occur for a variety of reasons. We inherently tend to be weak on the middle side of our quadricep muscle. There develops an imbalance, the kneecap doesn't track properly, and there are various regions of pain that will occur there because of that. Related to that is, patellar tendonitis pain. Here's your patella, the kneecap, here's the tendon that comes down into the knee. It's very common. Tendons don't have a great blood flow. Somebody does excessive training, they just, a lot of jumping, they develop some inflammation here. It's a very difficult thing to just wait to go away. It's something that you have to treat and correct what's going on to cause the pain.
Okay. Back pain, specifically lower back pain, Tom.
Yes,
or my aching back.
Very, very common. I'm going to pull the spine over. And, posture's huge. All of those parents that have told their kids, sit up straight, shoulders back, they're absolutely right. You have your area of your spine, you have your discs, you have the spinous process in the back of the vertebrae. With athletes, most of what occurs is either sprain or strain of the ligamentous structure of the back, strain of the muscles of the back. Again, it's overutilized. Most of these kids do not develop a core.
Yep.
They don't use the opposite muscle groups. They may have a lengthening problem in which their hamstrings may be tight, and they overutilize their back and do not really know how to properly recruit the core.
And you hear about that core a lot, Tom. I mean, kids, especially athletes, are, it's all about the core. So where does this come from? Why is it so popular, and what's the deal with it?
Typically, you'll talk to people that do core work, and they'll tell you they do a lot of abdominal work, a lot of different sit-ups, maybe lower abdominal work. What we don't do is we don't teach our workers, we don't teach our athletes, we don't teach the general public core is the ability to utilize your abdominal structure. It's a stabilizing muscle. It's one in which it gives the spine stability and supports the muscles of the low back. You recruit your core, you take load off the low back.
Okay.
So with our athletes, what we want them to do is not just recruit their core when they're doing sit-ups trying to get a six-pack. We want them recruiting their core in everyday activities. We want them opening the door, recruiting their core. Getting into the car, recruiting their core. Opening their locker, recruiting their core. We want use of the core to become so habitual that in a game, when they take, there's a collision or they have to go to the floor, you want them recruiting that core to help take some of the load off the low back.
Yep. At all costs, even, people our age.
Absolutely.
With the, I mean, you want to focus on it, habitual with anything, right?
Yes.
I mean, that's important.
And it's not taught. We need to get these kids recruiting core and utilizing it in their everyday functional activities and their sports.
Yep. All right, well, Tom, again, a wealth of information, very knowledgeable, and our viewers love this segment, man. You teach them a lot. You teach me a lot. So, and I'm an old former, has-been athlete myself. So, thanks for coming on board again. And we're going to have an additional segment with Tom, but we're going to implement into a future show I'll let you guys know all about that through Twitter and everything, all right? All right, Tom, thanks a lot again. Thanks
Pat.
for your
Thanks for
support.
having me.
Happy New Year, my man,
Thanks
all right?
And the same.
All right.